Hi, everyone, and welcome to the webinar today. Thank you for joining us and giving us your precious time. I am Julie Flagar, and I am the president and CEO of Project Sleep, a nonprofit to make sleep cool, or to raise awareness about sleep health and sleep disorders. And I'm very thankful today to be joined by the Sleep Research Society and Dane in Washington, D.C., who will be leading us through this webinar. But before Dane gets started, I just wanted to just give a little brief intro to say that when I was diagnosed with narcolepsy 11 years ago, I was very upset about a lot of things. It was a really hard challenge to take on this condition. But one thing I actually wasn't upset about at first, I just naturally assumed there would just be a ton of research happening, that there would be a ton of resources being given to narcolepsy and sleep. That was just an assumption I had. So it didn't bother me at first. And it's been a really big learning curve for me to realize that, that the resources available for different sleep conditions and for sleep awareness and sleep research is not just a given. And that we actually have a role to play in making sure that that funding is there year after year. And so if you take anything away from this, I hope it's educational because you might not even realize some of the issues that we are facing as a community. So thanks again to the Sleep Research Society and to Dane for educating us as a community on the issues that are at stake and giving us the opportunity to really make a difference and to do something about it. So with that, I will turn it over to Dane.
Thank you, Julie. And I think as we embark on this conversation about advocacy, Julie is an exemplary advocate. We're going to talk about things that are very important for moving the field forward, for advancing research, for making sure we have additional resources, and that all comes back to making your voice heard. Julie is certainly somebody, and is not unique in the community, that said this is unacceptable and how do we do more, and has taken it upon herself to try to make sure that we are advancing things and that it's moving in a patient-centered way. So certainly if you have any questions, she is a good resource for this. Let me cancel out of my, oh, sorry. All right, so I'm very technologically adverse. I've used Zoom more than a few times, but I have a habit of always managing to mess up any type of technology I'm interfacing with. So I'm gonna do my best to get us through this. I do wanna say thank you to Julie and also thank you to John from the Sleep Research Society for pulling this event together. We're gonna talk about how to engage with your members of Congress, and we're gonna do that within the context of the upcoming August Congressional recess and meeting with them locally, not coming to Washington, D.C. and visiting their office that's near Capitol Hill, but visiting them at the office they have, which is in your neighborhood and in your area. You might feel like you're drinking from a fire hose, but if there's one thing we want to stress as we go through this, we are trying to give you some context and some tips to be successful, but you do not have to be an expert. You don't have to be an expert on civics and government. You don't have to be an expert on diseases or research. You just need to tell your story. How to tell your story is the most critical thing. And we're going to talk about this. We're going to mention something that the government often mentions, which is a big part of what they call sleep disorders. But sleep disorders are unique, the same way that you are unique. When you're educating these members about these issues, when you're talking about your personal experience, make it as personal as possible. Talk about your experience. So when we use the phrase sleep disorders, it can apply to many different things, but talk about what you know. Talk about your experience and what you're dealing with specifically. We are going to have a Q&A session at the end. My hope is to be through this presentation by 30 minutes after the hour, out of respect for your time. But after that, we will answer some questions. I'm going to tell you ahead of time, I am not, this is being recorded, so I would stray away from any questions that might delve into personal issues or things that you've experienced or that might be medical in nature. I couldn't answer them anyway. And I just want to make sure folks know that this is something that's being recorded. started. I mentioned I'm technologically adverse. I did not advance that slide, but it advanced on its own. So we are, if that's the worst thing that happens, I'm going to consider us lucky. The last point that I'm going to make as I kick things off is politics is very divisive right now. There's a lot of strong opinions. There's a lot of things that people disagree over. We are not one of those things. We're not partisan. We don't have political opposition. There's nobody on the other side that is working against what we're talking about. What we're working against is probably something that you've experienced in your lives regularly. It's a lack of awareness. People don't know about these conditions, and they don't know what the current state of affairs is, and they don't know how they can help. We're going to use our personal story to give them that information. Our opposition is a lack of awareness and education. We're going to be the ones who provide awareness and who educate them. And Julie and I and John are mainly conduits to help you do that. We facilitate your interaction with these folks. They would much rather talk to you as their constituents and as the people that they represent than they would rather than hear from us. They're not that interested, and they're most interested in yours. And there we go. All right. So why we advocate. I mentioned we wanted to give a little bit of context. So what's the purpose of going to our members of Congress and ask, once again, I did not do that. What's the point of going to your members of Congress and asking them to support the things that we're interested in? Why engage with them? Why engage with your two senators and representative? There's a few good reasons for this. One is that Congress, I think everybody is familiar now, that Congress is involved in almost every part of healthcare, from coverage to access to treatment development, but they're also heavily invested in research. Congress has oversight authority. They oversee federal agencies. They're very much engaged on the federal research agenda. America funds a lot of research. Congress, on an annual basis, decides how much money goes to different priorities, how much money goes to the FBI, how much money goes to the Department of Agriculture, and how much money goes to medical research. This is a member-driven process. So when members like Tim Scott, who's in the picture here, are making these decisions and are trying to decide what's more important or how do we expend limited resources, they do that based on their constituents. They do that based on the input that they receive. So it's a member-driven process, but those members are driven by you. They're driven by the people that they represent. And in that regard, there's an expression we use. We say you can be at the table or you can be on the menu. So there is already a good pot of money for research. We wish there was more. We fight for increases on an annual basis. But one of the reasons we've come as far as we have is because there are people like Julie and others who have advocated for this and made the case and said, we need your help. If people weren't going to the Hill, if they weren't talking to their representatives and senators, if they weren't raising awareness of various sleep disorders, you could rest assured that that pot of money would start to diminish. They wouldn't just be taking action on your behalf because it's the right thing to do or because it's an area that they're familiar with. You want to be part of the process, and you want to have your seat at the table, and you want to have your voice heard. There are certainly benefits to making your voice heard, but there are also punitive outcomes if we're not making our voice heard. So what you're going to do this August is very important. It may seem a little bit intimidating, but one thing we want you to remember is that these folks work for you. They're going to make you feel very welcome. They're going to roll out the red carpet in some respects. What they don't want, much like a restaurant, they don't want a Yelp review or something on social media that says you had a bad interaction. So they're not going to give you the third degree. They're not going to ask you a lot of tough questions. They are going to welcome your input and make you feel welcome. And it's up to you to give them the information that they need to be successful on your behalf. All right, one more of why we advocate. So there's a couple things in specific we do within that broader context. So we try to advance medical research first and foremost and improve healthcare. In some respects, improving healthcare is a discussion that occurs subsequent to advancing medical research. So we need to have breakthroughs, we need to have scientific innovation, we need to have treatment options and even cures or diagnostic tools before we have issues about policy in the healthcare arena. So when we say Congress has oversight and Congress controls the budget, what does that mean? And for us, there's some very specific things that are important. The National Institutes of Health. The National Institutes of Health is the world's foremost biological research enterprise. It's currently funded at about $35 billion with a B dollars annually, and that's the money that goes out to do research all across the country. So it's not done in a government lab. If you watch 60 Minutes or you watch the news and you see a program about how scientists at UT Southwestern have come up with a bionic arm that somebody who's paralyzed can control with their brainwaves, or if there's a new treatment regimen available for autism as a result of innovation in Boston or Harvard, that money came from the National Institutes of Health. Scientists competed for that funding, and the most meritorious funds were awarded. But that money, 90% of that $35 billion, actually closer to $37 billion now, goes out across the country to fund various projects. That's NIH, and the Congress both determines how much money, and they also have oversight of where it goes. They try not to disrupt the scientific process, but they care about the things that their constituents care about. The Food and Drug Administration, of course, is involved in treatment development, has increasingly been trying to get a fix for what's important to patients. They were told for many years that they just have been looking at things as data and not as how people need them, and have embarked on a process with Congress to get a better sense for how the patients that they're meant to serve actually utilize the treatments and diagnostic tools that they approve. They want to know what the end user gets out of it so that they can be a more patient-centered organization, and that's a good thing. The VA and the Department of Defense, the Veterans Administration and the Department of Defense also have research programs. The VA program is heavily invested in sleep, as it might seem obvious. You know, there's issues that come up in the military related to healthy sleep, but they also look at sleep disorders, and they look at things like the effects of sleep on conditions like PTSD that are important to veterans. The Department of Defense also has a research program, one that sleep disorders are specifically part of, and one that we were named to because we asked Congress to include us in the defense research program, which I'll get to in a minute. But that research doesn't just apply to soldiers or combat readiness or anything like that. We're part of the program, but the research they do complements what NIH is doing. It just means there's more resources available for sleep disorders, and the good scientists can move good science forward. But we need to make sure that all starts with Congress, and that starts with us connecting with and engaging our members of Congress and having this be a priority for them. So one of the questions that often comes up is, does advocacy make a difference? You know, you host a fundraiser, you know how much money you raised. You do an awareness event or walkathon, you know what the outcomes are. We see a similar pattern. So it's not a direct link from point A to point B. You're going to go in and make meetings with these members of Congress. You're going to talk to their offices, and you might leave feeling like, did any of that make a difference? Because there isn't a clear outcome that necessarily occurred from your conversation. It certainly does. One of the ways we track this is with the sleep research portfolio. So we know that on an annual basis, Congress is appropriating money for the National Institutes of Health, and that NIH is doing sleep research. We ask for them to do more and more research in sleep. We try to make sure that there are scientists that are putting good applications in. And this is an overview of the past couple of fiscal years, starting from left to right. You'll see that the sleep portfolio has gone from $233 million to $313 million to $327 million. Those are all increases that occur because this is an area that continues to be a priority, and the community wants to make it a priority. One of the ways that Congress does this is they include what they call congressional recommendations or committee recommendations. When they write the funding bill and says this is how much money you get, they also kind of give a wish list, and they say this is where we wish you were spending it. They don't put every condition in that wish list, but you'll see from the slide here that the past couple of years they continue to say sleep disorders. And one thing I want to point out that's important is you'll notice that NIH is reporting on this is for the category of sleep research. We're talking about sleep disorders research. So whereas there have been large gains in sleep research recently, our question and the point we want to make with policymakers is we think more of that should be going to sleep disorders, not necessarily just the basic biology of sleep or the mechanisms of sleep, but how are we advancing research into individual sleep disorders? How are we improving health for different conditions? How are we curing diseases or improving diagnostic tools? Which research is going into these specific sleep disorders? It's not the same as the overall pot of money, which is just a big thing that they call sleep research. So that's a good example of how advocacy makes a difference and why we advocate. So what we're asking you to do is, I don't think it's any surprise to folks that it's an election year and that members of Congress are going to be keenly aware of talking to you, but they're also going to be spending a lot more time in their local districts. So everybody, I think, is familiar with the House and Senate being in Washington, D.C., but every representative and every senator is going to have local offices across the state. It's much easier for folks to make a visit with the local offices than it is for them to come to DC and make a visit. I mean, for the most part, if you live in Virginia or Maryland, maybe it's easy to drop in on the office, but every member of Congress has local offices, and they're meant to serve as a way for you to connect with them. The purpose of those offices is not to do work or to be debating policy or to be getting ready for news interviews. Those offices exist in your communities so that you can come in and take advantage of them. And of course, as we've seen from the Does Advocacy Work slide, the groups and the people that take advantage of those things see benefits that come out of it. But the first step is just scheduling that local visit. If you were going to do a meeting in DC, you'd be trying to thread a needle. You'd be saying, I need to be here at a particular time. What about a particular day? Scheduling a local meeting is much easier. The office is going to be flexible. They're just going to say when you want to come in. Next week, the week after that, we'll find a time that works for you. But the first step is just connecting with them. So if you want to do that, and once again, of course, scheduling is based on your schedule. So it's easier for you to schedule your own visit than it is for me or Julie or John to schedule a meeting for you, because it's going to be that kind of fluid conversation. When do you want to stop by? What works for you? You know, here's where we're at. So all you got to do to kick things off, everybody's got one representative and two senators. So you go to house.gov or senate.gov, not .com. These are government websites. And then in both, they want to connect you with your representative. So if you go in to find your representative on house.gov, all you do is put your zip code in that little area right here, and you click go, and it gives you a slide and it says who your member of Congress is. If you click on their picture, it's going to take you to their website. It's going to list the local offices. It's going to say one that's in DC, which is their DC office, and then it's going to list a bunch that are in your area. There's going to be probably 2 or 3 that are around you. Pick whichever one is most convenient for you and call them up and say that you'd like to come in on behalf of the sleep community and schedule a meeting and talk to them. Similarly, they have the same thing on the Senate side. If you go to senate.gov, the other chamber, you have 2 senators. You just pick your state because the senators represent the state, not the local area. And you click go, and it tells you who your senators are. It's going to bring up their picture. You're going to click on it. Same thing as the House people. They're going to have a DC office, and they're going to have a local offices. They're going to have local offices all over the state. If you're in Connecticut, there's probably one in each corner. If you're in California, they're going to be all over the place. But find the one that's most convenient for you, what's easiest for you to get to, and call that office and say, I'd like to come in and set up a meeting. And they're going to try to work with you to set up a meeting. They want you to come in and visit them. But house.gov and senate.gov is the place to start. And it's easy for you to figure out what's going to be easiest for you as you start to identify these members' offices. Now, one common thing that comes up, folks, they don't know who you voted for. They don't know what your politics are. The personal offices are different from the campaign offices by law. And even if you don't see eye to eye with these folks on politics, there's no reason to have a political tint to our debate. We're simply there as the sleep community to tell them we need their support for sleep research. If you go in and see the office, that's going to be the entirety of the conversation, and they're going to be most interested in you as a person as to how these issues affect you and what's most important right now. So we do have some tips for scheduling a local visit. One thing that comes up is there may be 2 different folks on this webinar that are both constituents of Scott Peters from San Diego. It's a little bit awkward, though it happens, for Scott Peters' office to have 2 meetings, let's say one next week and one the week after that are both on sleep and both talk about the same issues. So we encourage folks to work together. If you have friends that you talk to regularly on social media, maybe you have a support group, do it together. You know, you don't have to go in by yourself. Go in together. Maybe out of you and 4 of your friends, you have 3 different members of Congress, but that's okay. Work together and go visit all 3 of those offices together. Do it as a team, particularly if there's folks you already work with, already talk to on social media, or already have some kind of support group network with. There's strength in numbers, and everyone has a valuable perspective to contribute when you go in and talk, but do it together. The second thing is members of Congress are going to say, thank you for educating us, but what do you want us to do on your behalf? We're going to get into that in a second, but we also have what are called leave behind materials for you. Julie has a portal for these materials. It includes the community's current legislative agenda, and it also includes the letters that we're asking the members of Congress to send, which I'll talk about in a moment. But we have those materials. Print those materials off, take them with you and give them to the staffers after your meeting. You're going to leave and they're going to say, what was I supposed to do again? But if they have those materials, they know exactly what you're asking them to do. So get the leave behind materials from Julie or me, but we're happy to serve as a resource in that regard. Once again, be flexible when you reach out. They're going to say, you know, you don't have to try to thread a needle on a specific time. Work with them to figure out the time that works best for you, and see if there's a chance, if you can see the congresswoman or the congressman or the senator, say, hey, if they're going to be in the office, I want to have a time to say hello. They might be organizing events. They might make it work. It's possible that their schedule is going to be crammed with campaign stuff, so you might just be talking to the staffers, which is just fine. The staffers have the ability to make decisions on this. That's what they're there for. But you know, ask the office if there's any chance if you'll be able to see the congressman or the congresswoman during August. If you need anything, part of why I'm here is just to be a resource for you. So ask me, reach out to me. That's my email address. You have my phone number. If there's any questions, if you have any trepidation, if you can't remember where the leave behind materials are, don't hesitate to reach out to me. Similarly, Julie is happy to be a resource for Project Sleep and the sleep community as well. And I know John and the Sleep Research Society are going to have researchers that are doing the same thing. They're willing to be helpful as well. So any of us can be a resource, but don't hesitate to ask. All right, so you're going into these meetings. What's happening on Capitol Hill right now? What's the backdrop for our specific conversation? The first is the budget and appropriations conversation. And this is what we'll spend most time on. I'll make a quick plug. It is an election year. They're going to be spending more time than usual in the districts because come November, they have an election. So rather than being here in DC, they're going to be in the local community. Maybe you can't find a time to chat in August, but maybe you can find a time to chat in September. You know, they're going to be spending more time back home, and they're very keyed into what you have to say. They want to show that they're being responsive to you as the elections are coming up. But the main thing that they're doing is the budget and appropriations process. So every year, Congress creates a budget and they set the spending bills. They decide how much money NIH is going to get. They decide how much money the Defense Department's going to get. They do this annually. If they don't come up with the spending bill and they don't pass them by the first of the year, or by October 1st, the fiscal year, the government shuts down. We all know that happens sometime, but they have to do these spending bills, and that decides what the funding priorities are. So they've been working on these bills. They're not going to pass them before the election. They just don't do it that way. They're going to get these bills ready to go. And then after the election, so after November, they're going to come back to town for what they call a lame duck session. And that's when they're going to finish off the funding process. By the end of the year, they're going to have these bills done. So the time is now to talk about with these offices what our spending priorities are and what we need them to work on. So first and foremost, NIH funding. In order for our slice of the pie to get bigger, the overall pie has to get bigger. They're not going to take money from a different condition and give it to us. We need funding increases. We have had funding increases for the past 3 years. We asked for a $2 billion increase 3 years ago. We got it. We asked for a $2 billion increase again 2 years ago. We got it. We asked for a $2 billion increase again last year, and Congress actually gave a $3 billion increase. So they're very motivated to invest in research. We need them to keep this up. NIH was underfunded for so long that this money is just making up ground that was lost. So this isn't as if there's a research bonanza. We're just getting back to a normal funding level, but we need them to keep it up. We're not there yet. As I mentioned, though, one thing we know is that the sleep portfolio has grown, but we don't have, there isn't as much of a direct investment in the sleep disorders portfolio. So we want them to know we need more money because we need to keep bolstering the sleep disorders portfolio. Individual conditions that are considered sleep disorders need more research. Those are not getting hundreds of millions of dollars in resources. They're getting modest resources. We need those funding increases, and we need more money to be going to sleep disorders research. The House has proposed a $1.25 billion increase, not $1 million increase, but $1.25 billion. The Senate has proposed a $2 billion increase. So as we're meeting with these offices, we want them to take the Senate position. We don't want the $1.25 billion that the House is saying we should fund NIH at. We want the $2 billion that the Senate is saying. That, and of course, if you have a little legislative agenda, if you get the leave behind materials, you can just read this right off the fact sheet. But right now, they're proposing increases. We want the biggest increase possible, which is $2 billion proposed by the Senate, when they come back at the end of the year and try to finish off the spending bills. The Department of Defense also does sleep disorders research. NIH does research into any condition, and they just simply have a mandate to advance science. They do everything, all 7,000 rare diseases, big diseases, everything. The Department of Defense research program only funds research into conditions that appear on a list that deems them eligible for study. Every year, Congress creates that list, and every year, Congress decides what conditions are on it based on who asks them for help and who wants to be on the list. We have asked for many years. We are on the list. DoD researchers do very well competing for funds through the DoD program. It's currently funded at $330 million. There are only about 30 conditions that are on it. Being on it allows you to compete for that money, and scientists are doing very well. Sleep disorders research is being funded, and this isn't that broader category of sleep. This is focused on sleep disorders. This list is the Senate list. It is just a draft list. The spending bills are not done, as I just mentioned. We need them to finish them, and we need to be included again. So as they come back and finish this stuff off at the end of the year, keep us in the DoD research program and keep us on the eligible conditions list. Now, finally, the most pressing issue we're having before us right now is that the Centers for Disease Control and Prevention, I think people might be familiar with the CDC. They do a lot of work. They do cancer survivorship work. They do work on Zika virus. They do a lot of public health work. They have a mandate that says that they need to get the biggest bang for the buck. So they work on things like smoking cessation. They work on anti-obesity programs. They try to improve public health. I think we would all agree that healthy sleep is probably a very big part of public health, and one of the most disturbing things, along with diabetes or obesity. The CDC does not have a sleep program. They are not doing any public health activities that are focused on sleep and sleep disorders. There was a program that was funded a few years ago for 5 years called the National Healthy Sleep Awareness Project. CDC indicated they could not keep funding this stuff moving forward because they didn't have what they call a specific line item from Congress. Congress hadn't written into the budget in the spending bills every year, we're going to give money to sleep. They said, we just can't keep doing this on our own with our extra resources. We need Congress, the folks we're seeing in August, to, as they finish off these appropriations bills, to add in that line item of $250,000 to make sure that there can be a sleep public health program at the CDC. The alternative is nothing. And all that stuff that's been done for the past 5 years just kind of goes away. That's completely unnecessary. This is the reason. You could make an argument that they should be spending $2 million on sleep at the CDC. $250,000 is a nominal ask. It's something they can easily do, and they just need to feel the sense of urgency to put this in the spending bills at the end of the year. So we're going to be asking them to do that. We're asking them to lead what's called a sign-on letter to the appropriations committees that says, hey, as you guys finish the spending bills for FY19, you've got to include $250,000. If enough members join these letters and send them to the appropriations committees, they will include that money at the end of the year, and we will have $250,000 for sleep at CDC, and we can try to make sure that number gets bigger moving forward, but we just need to have it first. The alternative is nothing. These are some examples of what the CDC has been doing with those extremely limited resources. Many other stakeholders like the Sleep Research Society and some of the patient groups have just been donating their time to make and their effort to make these CDC program a success. $250,000 is not a lot of money by government standards, but we managed to do a lot with that. We do public awareness activities through that program. These are just some examples. We do provider education. So these are some examples of the studies that have been done and the science that has come out of it. But this is all made possible by the sleep program. So educating doctors and healthcare professionals. And there is peer science that goes on too. They gather data. They know more about sleep studies and surveillance and epidemiology, and scientists use that data. It's publicly available because it's taxpayer funded, and they write scientific studies and peer-reviewed journal articles out of it. This is just a few examples. All of that is out of a modest $250,000 a year investment, and we need them to keep that going. So you've called the office, you've printed out the materials, you've scheduled a time to come in and talk to them, probably a half-an-hour meeting. Maybe you're going in with your friends. There's just some very simple tips to making an effective visit. Number one, be on time. You know, I think Mark Twain said something like 90% of being successful is just showing up on time. It's true. These folks are busy. They do a lot of these meetings. They want to hear from as many people as possible. Do them a favor by being there on time or arriving a couple minutes early. You don't want to be the sleep community to be remembered as the people who showed up late or messed up the whole day. So be there on time. Introduce yourself and your group members. If this is an office that has constituents, so you're the person that is represented by them, make sure you do most of the talking. The key thing is education, not memorizing any of the slides about NIH funding or the CDC that I just told you. Educate them. Assume they know nothing about sleep disorders. Assume they know nothing about how to get your about your specific situation. You've probably been asked at the grocery store by others at work, you know, what is this all about? Give them the elevator pitch. Give them a good frame of reference for what you deal with on a daily basis or what these conditions mean to you. Make it local. Remind them that you're part of the community. You know, where do your kids go to school? Where do you go to school? What church or synagogue do you belong to? Remind them that you're one of the people that they represent. Explain your interest in all this, and the legislative agenda will have some more background in that regard. Go into the 3 issues we talked about and mainly say, we need you to send this letter that we have. And of course, you'll have a copy of the letter, so you'll know exactly what it's saying. We need you to send this to Congress when they reconvene in September. And we need this $250,000 for the CDC. Give them the leave behind material. So even if they leave the meeting and say, what were those folks talking about again? They can just look at the packet of info that you gave to them. And then finally, at the end, make sure you get their business card. Julie, John, and I want to know when you do these meetings. We want to know who you're talking to. It makes it easier on us to coordinate with the DC staff and other people. So, for example, if Congress is going to send these letters to Capitol Hill, we're going to want to make sure they're all working together. So if there's one Democratic office and a Republican office that both say we want to do this, we don't want them to do it in isolation. We want to link them up so that they do it together. We can do that for you after you've had these conversations. So make sure we know who you've been talking to or that you've done these meetings or how the meetings went. You can send that info to me. You can send it to Julie, but connect the dots after your meeting. And if you have their business card, most importantly, send them a follow-up email. We can tell them thank you a week after you've come in. If they don't believe that there's an expectation that they're going to take action on your behalf, they're just too busy to delve into what you gave them. If you send them that follow-up email, though, if you say, thanks again for meeting with us, I really look forward to hearing from you about how the congressman or woman is going to take action on this, they're going to want to be responsive to you, and they're going to show you, demonstrate some kind of progress. So getting their business card and sending them that follow-up email is going to be important. Here is my contact info once again. I'm sure many of you know Julie. We can coordinate very easily on these kinds of things, but we're here to be a resource. I did go a little over my time, but I see the chat box just lighting up with questions. So I'm going, rather than delving into the chat box and trying to go through all this, I'm going to hand it back over to Julie and John. And if there's any questions that have been asked that you think are important, let's relay them now, and then we'll answer them. So even at this point, if you have a question that you want to ask, type it into that chat box.
Thank you, Dane. So I think one question that's come up is regarding the slides. You know, there is some really great information provided here. So are people going to be able to have some of that key information written out for them about, you know, what they need to bring, or is it just the recording?
Yeah, the recording is the easiest way to make note of that. That's going to be posted, so you'll be able to review all of this. But basically, you know, the key thing for setting up these meetings is that going to house.gov or senate.gov, finding your local office, and then reaching out to them to just simply have a conversation. Julie in the link to the webinar has the leave behind materials that we referenced, and all we ask you to do is to keep us posted on what you're doing. If you do go in and do one of these visits, you know, make sure we know how it went. It makes it easier on us to know that we might have a possible champion out there for the community.
Okay, that sounds good. And if anyone has any questions, I'll try to make sure you guys have the pertinent information, and please do not hesitate to reach out. We have a few great questions about connecting people, so I will try to look at who signed up for this webinar and try to connect people that are in the same area. So I will try to make some of those connections this week for you guys. So that would be really, really great. We had, I don't think any other major questions. You did cover, I believe, about that because it is an election year, that they will actually be back more, right?
Yes, they will. There are two things. One, they're going to be spending more time in your area or back home than they're spending in DC. And secondly, they're going to be they're particularly interested in what you have to say. And when what we're talking about is not anything that's political, there is no Democrat or Republican angle to this, it makes it easy for them to take action. They're going to want to show you that they're trying to be responsive to your requests before November. And what makes that even easier is what we're asking for is pretty reasonable. It's ridiculous that the CDC doesn't have a sleep program, given how important sleep is to public health overall. And we're just asking for them to support $250,000 to make sure that we can continue to have one or start having one moving forward.
Yeah. We have a question about how do we draw the line between sleep health and sleep disorders?
Yeah, this comes back to you should approach these meetings in a manner that you're comfortable with. If you're a public health professional or if you're a researcher, definitely talk about this as research. Talk about what you're doing, talk about your lab, talk about what you've studied, talk about things you've seen or recent literature. You know, that sleep health is very important. If you're a patient, though, or if you're somebody who is affected, don't try to delve into statistics and data. Simply explain what your experience has been. Julie is very good at this, but all you have to do is, you can even write it out ahead of time if you want to practice it a little bit. I'm sure people have asked you before, either at work or at a grocery store, what's the deal? Tell them, give them a little explanation of your disorder, and that doesn't even need to be a disease or a rare condition. Even if it's just the idea of healthy sleep in general, or school start times, for example, which there's been a lot of research on. If there's something that you're particularly familiar with, use that as your jumping off point to educate them, but make sure it's something that you're comfortable talking about and it relates to your personal experience. So if your personal experience is something that's disease specific or disorder specific, I would talk about that, and don't talk about anything else other than your own experience. And the same is true for healthy sleep. If you're more interested in healthy sleep or sleep health, and that's something that you're more comfortable discussing, that should be your jumping off point with these folks.
Yeah, and I would just add that's exactly how I would see this, and also to think that I think that we have to know that we need all boats to rise. That when we talk about the CDC, that's sleep health, but that's also really important to me as a person with narcolepsy, that our society knows about sleep health. So we can speak to our experience, and then when we get to the legislative agenda, that we can share those asks that are both about sleep disorders and sleep health.
And this CDC program has to, for now, it has to do it all. It's not, narcolepsy specific or anything else. It is just a sleep program. So it's meant, they have to leverage their resources at CDC and with the community to do anything they can on sleep in general, wherever they can get, make progress. But the difference that we have right now is between having a sleep program and having no sleep program. And it's unfortunate to think that there just might be no sleep program at all at the Centers for Disease Control and Prevention.
Yeah. Okay, so we have a great question to just kind of recap what people should be doing next. I would say, and Dane, jump in too if I miss anything, but to go to the websites, the House website and the Senate website, find out who your representatives are, and find out the local office. Your goal is to schedule a meeting with, one or all three, because you'll have 2 senators and 1 representative, to schedule meetings. And then you would bring the webinar materials, those leave behind materials. It's 3 pages. You would bring that with you to the meeting. Those are what you would leave with them. So you would go into the meeting, you would talk about your experience, and those sheets are to help with the ask language, the language of how can Congress help us as a community. So that would be what you would leave with them. And the goal is that they will get interested, and hopefully if you circle back with myself and Dane, we can coordinate with those offices afterward to try to move some of those offices forward to help champion this cause. And also, of course, to send your own thank you to the office as well within a week.
And maybe they ask you a question that you don't know the answer to. Just tell them that you'll find out and get back to them, and tell us what they asked, and we'll help answer that question for you. It should be relatively straightforward. And Julie, you've done this before, and you're very good at it. So do you have any tips? We always tell people you're only a first timer your first time. Once you do it, you realize how accommodating these offices are and how productive it is to build a relationship with the staff. And it becomes kind of easy, but it can be daunting the first time around. Julie, do you have any tips for a first-time advocate who hasn't visited an office before?
Definitely. I think I was really scared at first, but Dane is he's so right when he said that these people are there to serve you. Getting the undivided attention of, even a staff member is really exciting, because they actually are there to learn, and they're excited to learn. And I know that often in our lives, we feel like people aren't really excited to learn about our condition. And so it's actually a very nice experience. It has been for me. And that they can learn. And so I usually, because I have narcolepsy, I just tell them, I don't go into my full story, but I just go into a few things like saying that, for me, when I feel sleepy, I feel as if I haven't slept in, 48 to 72 hours. I also always mention how this is not just a falling asleep at random times condition. This affects every day and every night of my life. It's a 24-hour experience. And I think that's a really good reminder to just get the seriousness across. Project Sleep has some information. We have a narcolepsy fact sheet. We also have some basic facts about sleep health and sleep disorders, if you want to look over those to help you think about some of that language.
I saw a couple of questions come over the transom. Just so you know, these offices are usually in like a federal building or even like a strip mall. You might drive by them every day and have never even realized they're there. When you check in, it's kind of like a doctor's office. They have just a reception desk and a waiting area, and you're going to tell them, who you're there to see. And meetings typically run about 30 minutes. So you probably have about 20 minutes to chat with them. So think about ahead of time any information that you want to convey about the condition or the experience or the community or what you think is most important. So they're going to take time with you, but these conversations usually just run about 15 to 20 minutes. So if you're trying to schedule your day, you can plan with that in mind.
Well, thank you guys. Thank you, Dane. If anyone has any more questions, please do not hesitate to reach out. That's what we are here for. We can't wait to work with you. We can't wait to hear about your experiences.
I can make a final plug. It would just be, we're going to have an election in November. And then we're going to have a lot of new folks. So all the folks we educated and asked for help this time around, there's a good chance they could be different people next year. So I wouldn't view this as a one-time opportunity. I would encourage you to work with Julie, and the sleep community needs advocates, and they need people who can educate their members of Congress on an annual basis, or do that kind of relationship building activity. So don't just think about August. I would already be thinking about maybe February of next year too.
Yes, definitely. I mean, I think I try to tell people it's like building a relationship. And so their first meeting, it's not like we're going to always be able to, it's relationship building. But the cool thing is that it actually happens. And so now talking with my representative's office, they're like, oh yeah, hey, we know you, and it's funny because it's just really nice to see that you can make a difference and they will remember you. And we can keep educating people.